First of all, I want to just give you an overview of what you can expect today. We'll have a panel of experts talking about COVID and what what COVID is and some ways that we can start to protect ourselves and continue to keep ourselves safe during COVID. We'll also have someone talk about the layers of trauma that children of incarcerated parents and their parents and their family members experience, and how COVID brings an additional layer of that. We'll also follow with a panel of people who are personally impacted, who will be talking about their experiences during COVID and some of the things that they're learning from others who, family members, people who are parents who are incarcerated, but we'll also hear from the youth. This is a two-part series. Part one is exactly what I described, and I'm so happy that you're all here for today. Part two will be a response to that. So it will be strategies and strategies and policies and things that we can do to further advance the cause and the well-being for children, families, and people who are personally impacted. So that's a review of the morning. I want to give you direct your attention to our chat, and also there'll be opportunity, our chat room, but also there'll be opportunities for you to enter questions, and we'll take questions at the end of the first panel and also at the end of the second panel. At this point, I want to direct your attention to the chat box. In the chat box, we've listed the inaugural steering committee for the newly formed Bay Area Children of Incarcerated Parents Partnership. It is a regional partnership made up of at least 7 counties around the Bay Area, and we are co-sponsors of this event. The steering committee members' names are listed there in the chat. What else would I like to share with you today? I think that I would be remiss if we started this meeting without acknowledging what is happening in our communities and in our streets. And I know that this is a particularly painful moment for children and families of the incarcerated who experience trauma and racism every day. So I'd like to just pause for a moment to remember George Floyd and all of the others who have died senselessly at the hands of law enforcement. Thank you. I am so very, very excited about today and this joint partnership with the Bay Area Children of Incarcerated Parents Partnership, and also the Children's Defense Fund of California. I'd like to introduce the Executive Director of the Children's Defense Fund of California, Shimica Gaskin. Shimica is the Executive Director of the Children's Defense Fund, and she'll tell you a little bit about that when she takes the mic. But she has a background in law and public policy, specializing in legislative, regulatory, and policy issues. Prior to joining the Children's Defense Fund of California, Shimica served as the acting Deputy Assistant Attorney General in the Office of Legal Policy at the United States Department of Justice. So with that, I'd like to turn it over to Shimica, and I'll come back at the end.
Thank you, Carol. Good to see you. And I'm really excited about today's panel and the panelists that we have. And for all of you tuning in, the participants that you're here to be with us today. As you mentioned, I'm the Executive Director of the Children's Defense Fund California. We are the state office of the child advocacy organization that was started by Marion Wright Edelman in 1973. And here in California, we really work to ensure that children get access to equitable education, quality health care, that we reform our juvenile justice system to maintain one that uplifts youth in their development, and that we are making sure that families have opportunities for economic justice. And so today, I'm happy that we are being able to have this conversation grounded in not only the COVID pandemic, but the pandemic of structural racism that we are all fighting to dismantle. I'm really excited because the panelists that we have coming up are Dr. Jocelyn Freeman Garrick and Dr. Joyce Dorado. Dr. Freeman obtained her undergraduate degree from the UC Berkeley and a medical degree from the University of Southern California. She completed a transitional year residency at the Albert Einstein Hospital in Philadelphia, Pennsylvania, followed by an emergency medicine residency serving as the chief resident at the Albert Einstein Medical Center Hospital in the Bronx, New York. Dr. Freeman is currently an associate professor in the Department of Medicine at the University of California, San Francisco. Dr. Freeman completed her postdoctoral fellowship and obtained a Master of Science degree in clinical epidemiology and health services research from Cornell University. She's primarily interested in research that addresses violence prevention through health education, economic opportunities, as well as societal impacts on health. She currently serves as the attending physician in the emergency department at Highland Hospital and the director of disaster preparedness for the Alameda Health System. She's a proud mother of 3 boys, and so we're happy to have her here. We're also happy to have Dr. Joyce Dorado. She's the co-founder and director of the UCSF Health Environments in Response to Trauma in Schools, also known as HEARTS. Dr. Dorado is a nationally recognized expert in partnering with schools and other youth-serving systems to create trauma-informed, equitable healing organizations. She serves as an appointed member of the California State Supreme Court's Justice statewide steering committee for the Keeping Kids in School and Out of Courts initiative, and she's the lead curriculum developer and member of the founding work group for the San Francisco Department of Public Health Trauma-Informed Systems Initiative, and provides training and consultations across the Bay Area in collaboration with Trauma Transform, a Bay Area regional trauma-informed systems system. We are so happy to have you both here. Thank you for joining us. And I wanted to begin our conversation this morning, but really thinking about, now we've been here for almost 11, 12 weeks, Dr. Freeman, with COVID. And, beginning just with why sheltering in place has been important, why our communities and communities of color have been disproportionately impacted.
Well, thank you for having me, Shimica, and thank you for that introduction. And I have to say to start, it feels a little odd to hear someone read your bio and talk about you. You're like, who is that? When I really just see myself as a mom and a daughter and a friend. But I appreciate you giving me this opportunity to share what I've learned. I am normally an emergency physician, but I do disaster preparedness for Alameda Health System. So I've been able to acclimate and share with your audience about COVID. So COVID-19, I'm sure everyone knows by now, is a virus that we've never seen before. It is similar to the flu, and many people listening, I'm sure, have been proposed to get a vaccine. It's been offered to them for the flu. COVID-19 is different because we've never seen the virus in our community. Every 100 years, there's a pandemic. So most researchers weren't surprised by COVID-19. And 1918 was the first time we saw the flu. The influenza hit, wiped out about 5% of the population. In the spring, it came back in the winter and wiped out close to 10% of the US population. So all the frenzy and concern around COVID is due to what it's doing now and what we unfortunately hope doesn't happen when it comes back in the fall and winter if we don't have a vaccine. The flu has a vaccine, and that prevents people from dying and people from getting as sick. But with the flu, about 0.1 to 0.5% of the population dies every year across the world. Right now, all the frenzy about COVID is because close to 4%, some say 5% of the population who gets it is dying. So that's scary, and that is what our data is showing in the state of California and the United States. So why the sheltering in place was your question. COVID transmits through multiple means. The flu does transmit through contact. So when we say contact transmission, it means if you touch a door handle, if you wash your hands and you touch the faucet, it can persist on that surface for about 10 minutes. With COVID, they think it could persist for up to 24 to 48 hours. So that's a big difference. And that's really scary for people to prepare for and try to decontaminate for. The other thing is with the flu, like if you cough and if you have a runny nose, if secretions from your nose, if mucus or you cough gets into the air, they thought it would persist for 1 to 5 minutes. And with COVID, they think it could persist for up to 30 minutes. So just respiratory droplets, just the virus kind of hanging around in the air, persists a little longer. So these are just some reasons, in addition to how much more deadly it is. Across the world, they recommended we shelter in place to control the contamination of others and cross-infectivity, you being able to give it to someone else. They found that in China and in Germany and across Europe, this was effective in preventing the spread. So that's why we shelter in place, to keep everyone safe. But obviously, a lot of us, including myself, still have to go to work every day. Sheltering in place is effective to decrease the spread. And in California, for all of you who have been watching the news, you see how the numbers were in New York and how they were startling in some places in Louisiana and Washington, D.C. And California is actually like 10% of what's happening in New York as our numbers. But California and here in the Bay Area, I don't know where all of the audience is, but I'm here in Oakland, California. We were like the first in the country to shelter. In the Bay Area, we sheltered 3 days before the rest of the state, and then the state caught up. New York, even though they were a month ahead of us with the disease, they sheltered after we did. So we're confident that the reason our numbers did not escalate astronomically is because of the sheltering in place. So it's important to keep people safe and healthy and prevent widespread transmission of the disease. We're also somewhat in a different situation. You know, New York City has like 10 million people, at least 2 to 3 million in a condensed area, right? So it is really hard to prevent, you know, contact transmission. And our state, you know, varies widely. We have rural areas, we're more spread out. So that helps us in some sense. But we do need to shelter. That is why. And I think I'll try to let Dr. Dorado transition here, and then I can answer about the race and ethnicity. But what we're seeing now in the hospitals with the sheltering in place is people were told to stay home. So even if they have diabetes, hypertension, asthma, they were trying to stay home and waiting till the last minute when they come in with asthma in extremis or come in with diabetes out of control. And that isn't the message we want. If you have a medical problem, you need to come in regardless. And we're seeing that with sheltering in place, there's more stress, there's more trauma, there's more interpersonal violence, there's depression because you can't get outside. You're stressed because a lot of people have lost work. And what I'm seeing now in the emergency department is people coming in with what we call somatic symptoms. And it just means stress can cause you to have physical problems. You know, you can get a tension headache, you can get you can get stomach upset, burning pain, weakness, and a lot of it is attributed to the stress, which is what I thought Dr. Dorado, with her expertise, can just share and talk about.
No, I think I appreciate you bringing that full circle, because on two of those messages, why it's important that we're sheltering in place, that we've seen it's had an important impact in keeping our numbers low, but also the other ancillary effects of, you know, the messaging around not coming in when you have other issues. And I think Dr. Dorado, you know, really trying to understand in your work, you know, how has the pandemic affected families already dealing with trauma, and what's important for them to know as well.
Thank you so much for inviting me to speak. And I just want to name, and what we hopefully all know, that we are all experiencing a collective trauma, So we're all experiencing fear of infection, loss of our jobs, housing or food insecurity, depending on, frankly, the skin we're in, and our access to resources, sadness, grieving of people, of livelihood, the countless lost experiences and celebrations of milestones. And on top of the pandemic that everyone is experiencing, people of color are continuing to experience the ongoing trauma-inducing effects of racism, especially, and for example, individually mediated racism and structural racism and xenophobia. And so what's so poignant at this moment is that on top of the disproportionate effects of the virus and the higher death rates for Black people, largely, and we all believe because of these structural oppressions, now on top of that are the recent heartbreaking killings of George Floyd, Breonna Taylor, Ahmaud Arbery, so many others. And we are calling this sociocultural trauma. It's the ever looming and too often real danger and threat that one's safety is not as important as another person's safety because of the lottery of birth, the color of my skin, who I love, where I was born. And this is a piling on to the already existing stressors of the pandemic. So how might this show up in kids? Just because we're talking about young people here and how we can help them. There are increased fears of being alone, fears of going outside, fears of their parents leaving the house, clinging. You might see clinginess, you might see some withdrawal, some, kids not following our instructions and rebelling against directives, irritability, aggression, crying, tantrums, difficulties sleeping, difficulties concentrating. So doing one's homework or remembering to do the chores, sort of avoiding school, in air quotes, what we have here, and these health difficulties that Dr. Garrick so aptly put. And I just want to encourage us as adults to, when this is happening with our kids, to remember that we are all under a great deal of strain, including our kids and us too, and we are probably on short fuses too. So how do we take a breath and just, okay, we're all having a hard time here. How can I help you as the parent? I also want to say that on top of for children of incarcerated parents, there isn't only the fear about the pandemic and the sort of general grief around losing a parent to that separation, but the COVID compounds that, because we're worried about our parents' health. If we're incarcerated, we have incarcerated parents. We can't visit them the way we might have otherwise. So the piling on of the structurally racist truth of the mass incarceration of Black people and brown people, it's all part of that, what we call allostatic load, that sort of piling on of stressors. So I do want to say that, and I know I'll get a chance to sort of address this later, but I want to say it right here, that it is also true, we have to face down this brutal reality, but it's also true that experiencing these sorts of traumas does not mean that those of us who are trauma impacted are irrevocably damaged. It is absolutely possible to heal from trauma, to overcome adversity, and people on this call are testimony to that. So I want to make sure we get a chance to talk about that too.
Thank you so much for that. And we will come back and talk a little bit about some of those ways that we can heal and move forward. Dr. Freeman, I do want to lift up, because we are in the middle of two pandemics, and there is civil unrest right now, but at the same time, we know that some testing sites have closed. People who are still worried about getting COVID are concerned about whether they take to the streets, and if you are in the streets, how can you keep yourself safe? So I thought maybe it'd be important if you could share a little bit about what's happening with testing, and if you want to be out there and protesting, like, how can you keep yourself safe?
Okay, thank you for that. And I'll try to add now, you asked me about race and ethnicity. which I didn't address. So in the state of California, as all of your audience is primarily from our state, we do disproportionately see in our Latinx population. Our Latinx, I believe, is about 38%, 30 to 40% of our population. They represent more than half of our COVID cases, more than half. About 55% of individuals who get COVID in California are Latinx. African Americans represent about 5% of the population, and they're about 10%, so double the COVID cases. The racial and ethnic disparities, I think no one really knows, are likely due to delay in treatment, which would be the structural racism as far as death. As far as death. And is that delay in treatment once they get to the hospital, or delay in you going to the hospital? So both of those could be impacting it, as well as if I drive around my neighborhood in Oakland, California, most of the essential workers are Latinx and African American. If you go to the cdph.gov website, it lists all of the data, the statistics that we have on race and ethnicity and COVID in our state. It shows you there that of those Latinx, for example, who get COVID, about 54%, 75% of those are between the ages of 18 and 50. So they're younger people who have it, and they could be the asymptomatic carriers. They have no symptoms, but they have it, or they have mild symptoms and they have it. But those aren't most of the people who are dying. People are dying to be over 60, 70, and 80 years old. So the hypothesis that some have considered, including myself, is like in my family where I grew up, you had multiple generations in the home. You have the grandparents, the parents, maybe an aunt, and if you have multiple families in your home, then the essential worker, the teenager, you know, I used to work at Kentucky Fried Chicken. I would come home to my parents and my grandparents. And if your grandmother has diabetes and you're going to In-N-Out Burger to work every day and you carry it, you are passing it on to multiple people in your home. You're also not effectively able to isolate and quarantine. They have found that, you know, if you stay in a 2-bedroom home or a 3-bedroom apartment, but there are 8 people in your home, are you able to isolate? We recommend, if you have symptoms, to use just one bathroom. The rest of the people in the home shouldn't be using that bathroom. You should stay in one bedroom. No one else should be in that bedroom. How effective is that? And is everyone in that home receiving information in their primary language and their literacy to tell them you have to wear masks all day in the house? You have to constantly decontaminate and wipe down with Lysol wipes or Windex, whatever you can make or afford, to wipe light switches and tabletops to prevent spread to your immediate family members. And the data is showing if one family member gets it, there is a ripple effect. The whole family then ends up getting it. And then usually the oldest in that family will get the complications and end up hospitalized. So that's just one example of what's happening. No one is able to explain why African Americans are having double the death rate. So by the numbers, they're not the highest number by cases in our state, but by percentage, you are more likely to have death if you are older African American with COVID. So they have to do some interventions. And so for us on this call, staying educated and informed and figuring out what resources you can get to isolate and quarantine and get tested. So the other thing is a lot of our communities are not getting tested. They don't know, but they have to go out to their construction job. They have to do their contracting and painting job. And they're working with other men and women without masks and without using hand sanitizers. So we must do those protections, especially knowing how it's impacting our community. As we transition now for the last few days with the protests, knowing that people feel impassioned to injustice and you want to do something, you can consider doing something virtually. But like my sons, my 2 teenage sons who wanted to go out and protest, I think that you should do it safely. So I can't recommend that you not protest because of COVID, but I can tell you that my skin was standing on end, the hair on my skin, when I saw how clustered those folks were, and wondering when they went home if they didn't take off their clothes as soon as they got home, you know, at the porch or in the driveway, and then put them immediately in a washing machine or a separate bag and shower. That causes me great concern. You can protest, but you should have a mask on. You shouldn't hug, you know, your neighbor in solidarity. You can give them the elbow, or, you know, just the air hug, and try to stay 6 feet apart. If the crowd is getting chaotic and impassioned, then take a step back, especially if grandma lives with you who has hypertension and you're going to go home to grandma. Everyone is expecting that our COVID numbers are going to go up in the next 2 to 3 weeks because of the protests. So that's really scary. And most of the people protesting, a lot of them look like us. It's wonderful that it's been a rainbow of protesters, but I see a lot of Black and brown and Asian people, and that as a physician makes me scared when they're not doing the social distancing.
Thank you so much, and thank you for sharing some tips about how to do it safely. So we only have a few more minutes, and I do want to give Dr. Dorado the opportunity to share, you know, what can we do to bolster young people's, you know, resiliency right now dealing with these 2 pandemics, and then we'll see if there's any questions in the chat.
Thank you. So what we can do to bolster children's ability to cope. So while this pandemic is causing an incredible amount of suffering, there is a lot of science about how we can prevent long-term consequences of stress. So there are protective factors that we can bring in to mitigate the effects. And one of the most important ones is the support of caring others. It's also, I just want to say, important to know that if we are given the opportunity, when we are given the opportunity to heal, we actually can come out the other side stronger and wiser than we were before. And again, many of us on this webinar are testimony to that. How can we draw from the ways that we have overcome as individuals, as well as a people, to overcome the adversities that we've seen? There is a lot of strength there that we can draw on. So specifically how caregivers and professionals can help. First of all, I want to say, if you're a parent or a caregiver of a young person, make sure you're attending to your own wellness. On the airplane, they tell us you got to put your own mask on before you put the mask on to the person next to you, and that's absolutely true. When we're talking with our young people, can we acknowledge and honor their feelings of frustration and grief? When we name the feelings, it actually activates different parts of our brain and helps us to metabolize the stress neurochemicals that can be toxic to our bodies. Working with trauma is all about naming the unnameable. How can we, in developmentally appropriate ways, also talk about the impacts, this sociocultural trauma of racism and xenophobia, and what we can and must do to overcome these effects, and what we have been doing. Connection is, as I said before, one of the most important things. Trauma, chronic stress, and traumatic stress is toxic, and the medicine is love. Love is the medicine. The resilience literature tells us that the most important factor in resilience in the face of adversity is having a caring adult who loves you no matter what and who believes in you. How do we be that for our children? It's also important for young people to be able to connect in a physically safe way with friends and relatives. So how can we help with that? How can we help our young people call their elderly relatives and connect with them? That's a twofer, because you're both providing connection and a sense of purpose. How do we extend grace to ourselves and our kids? Physiologically, I just want to name that, like, deep breathing, especially that long, slow exhale, and movement help us to metabolize those stress neurochemicals that, if they just sit in our body, can make us sick. I want to name that a sense of agency is very important. We feel so helpless in the face of this. So how can we focus on things that we can control? I cannot control whether those people over there are socially distancing properly, but I can control what I'm doing and how I'm interacting with people, and that I'm wearing a mask. I can do things again and create opportunities for my young people. And frankly, they're pushing me around this on what we can do to have a sense of purpose and to do something about what is happening. And if you're not going to protest, there are many other actions that we can take to try to mitigate and overcome and counteract the effects of things like structural racism that is killing people. Predictability and structure is another tip here, that like, there's so much uncertainty. Can we create some structure and routine to our days? Knowing that for some this feels comforting and for others it feels stifling, but sort of trying to adjust to what is needed. How do we make meaning of what we're of these times? I think a wonderful thing is for us all and our young people to journal how we're feeling, what we're going through. These are historic moments that we're in. And when we can make meaning of our experiences, this also helps us to heal. Finally, I want to say that there is so much stress and so much suffering. It is incumbent upon us to also try to cultivate positive emotions. And I don't want to Pollyanna-ish this, but when we can feel gratitude, awe in the face of what people are overcoming, when we can laugh with each other, when we can be kind to each other, altruistic acts actually light up the same pleasure centers in our brain as good food. We need positive emotions to counteract the toxicity of all of the anger and stress. So if you want to check this out, and actually lots of really great tips for parents and everyone, check out the Greater Good Science Center. They have science-based practices that can help us to try to be resilient in the face of this. And the last thing I want to say is all of these tips are very important and things that any of us can do. And if you are suffering and these things are not helping you, please do ask for help. You get to feel better. There are professionals who can help you, whether that's mental health professionals or your spiritual leaders or other adults or other kids. Do ask for help, because there is help for you, and we can together heal from all of this.
Oh, thank you, Dr. Dorado. I can't see the people, but I know as a woman of color, I'm feeling so many of the things that you are saying, and I have gratitude that you were able to share those tips today, and just appreciate you and Dr. Freeman so much. Thank you for taking the time. I know you both have to get back out into the field, and so just thank you for being here. Thank you for sharing. We'll put the greater good in the chat. I don't think we have any questions, so we're just going to go ahead and transition to the next panel, but we appreciate you, and thank you so much for being here.
Thank you.
Thank you.
So we're excited for the next panel, and I'm really excited. It's going to be a dynamic group of individuals that you'll get to meet, but I get the honor of introducing Sylvia A. Harvey. She is an independent journalist and author. She reports at the intersection of race, incarceration, gender, and policy. She's the author of The Shadow System, Mass Incarceration and the American Family. Harvey has been on Vox, Elle, Color Lines, The Nation, The Appeal, The Feminist Wire, and more. Her commentary on race in the criminal justice system have been featured on NPR, WBAI, Women's Media Center Live, and the Robin Morgan, Huffington Post, Radio Curious, and beyond. She is the recipient of a National Headliner Award and a National Association of Black Journalists, a Salute to Excellence Award. She's an Oakland native and holds a BA in sociology from Columbia University and an MS in journalism from Columbia's Graduate School of Journalism. She currently lives in New York City, but I know Oakland is her home and her heart. So welcome, author Sylvia A. Harvey.
Thank you for having me. This is a very, very important conversation, and I am very happy to be a part of it. I started reporting on families impacted by incarceration about 3 or 4 years ago, because there's this idea among so many people that once a person is incarcerated, that their life simply vanishes. And, you know, as a journalist and as someone directly impacted, my father actually served 27 years in California prisons. I know that there are so many different things that take place for the family member, for the child, that goes far beyond the person that is incarcerated. So really just making sure that people are aware of everything that happens around the people that are, that have family members that are incarcerated. And so that's why I reported on the shadow system, to really just look at the different issues that are happening, whether that is in our educational system, looking at the school to prison pipeline, if that's looking at our foster care system and looking at the Adoption and Safe Families Act, but really looking at all of these different systems that are impacting our families that are already dealing with incarceration, and sort of making sure that people are aware and figuring out what it is that we can do. So I'm happy to introduce our panelists. Sam Lewis is an Anti-Recidivism Coalition member and director of Inside Programs, a first of its kind initiative. A former life prisoner himself, Sam oversees the Hope and Redemption team, 9 former lifers who go back into California state prisons with messages of hope, redemption, and helps prepare participants for successful reentry into our communities. Karen Ariano is a POPS communications interns. POPS, the club, which stands for Pain Over the Prison System, creates a safe, empowering space in high schools where children have either parents that are incarcerated or family members that are incarcerated. Karen grew up in Los Angeles and is preparing to graduate from the University of California, Irvine, in political science with a minor in economics. We have Karen McDaniel. Karen is the co-founder and executive director of The Place for Grace, a nonprofit dedicated to restoring families and advocating for families impacted by incarceration. Karen has been an integral part of the educational, social service, and criminal justice reform arenas for more than 25 years. 2 of our other youth, we have Layla Butcher, is a 16-year-old Project What youth currently attending San Leandro High School. She's been a member of Project What since 2018 because it's imperative that people are aware of what's happening to children that are impacted by incarceration. And we have Jacia Diamond, which is also a Project What youth, set to graduate high school this year. Congratulations. She's been a part of Project What since June of 2016. And she says it's a program that has been essential to her personal healing. And she has plans to be a child psychologist. So just as a background, you know, COVID-19 is a national issue. This is something that we've been dealing with, you know, across the country. And according to the Marshall Project, as of May 22nd, we have 34,584 cases of people incarcerated that have come down with this virus. Of that, nearly 35,000, 18,000 have recovered, and 454 of those prisoners have died due to coronavirus-related causes. And in California specifically, there's been 1,216 cases and 9 deaths. And obviously, as we know, there's a huge sort of difference between all the states and sort of the access to testing, the access to sanitation, the capacity to social distance inside these facilities. And Sam, since he's going inside these prisons and talking to families directly, I would love to start off with you, Sam, to just tell us, you know, one, what this work means to you. Just give us a little bit more information about why you're doing this work, what it means, and how you're doing given what's happening in this country today. And then just tell us, what are you hearing from families? What are they saying? What do they need? What's going on?
Thank you, Sylvia. Thank you, everyone that has joined us today. I want to just give you a quick update that literally just came in the last 5 minutes. 2 more people have died in California State Prison, so the number is now 12. And the number of people that are actively in custody that have been affected is 1,990.
Wow.
So the numbers continue to tick up because, as you said, there's no way to social distance inside these facilities. And like literally this just came across my email and I put it up. So for me, I spent 24 years in prison. My eldest daughter grew up, she was born a month after I was arrested, so she grew up while I was incarcerated.
Mhm.
And I've watched while incarcerated as she grew without me there, and even the work that it's taken for us, that we're still working on to heal the wounds of me being incarcerated and her growing up without a dad that was physically present. It's hugely damaging and takes a lot of work that seems to be never ending to be able to heal those wounds. So that's how or why I got into this work. I'm now the executive director of ARC, the Anti-Recidivism Coalition. And what we do, our mission is literally to end mass incarceration in the state of California by empowering formerly and currently incarcerated people by providing resources that range from advocacy and changing laws to housing, therapy, careers, everything a person that may have been incarcerated would need to be able to get back on track, be able to give back, and be able to change the system. So we've now changed 17 state laws that have made our system a bit more equitable, but not as equitable as it needs to be. We're in the process of changing 3 more state laws, and we've had 1 statewide initiative that we started, and we're deeply involved in Proposition 57. Currently, what we're doing, we've been in communication with the governor's office, other community-based organizations across the state. So the 3,500 people that were released, we assisted with transportation. We were one of many community-based organizations that help people receive rides home from the institutions to their places of residence, whether it was transitional housing or housing with family. We've also been encouraging and advocating for the governor to release more people in order to create the ability to social distance. We've donated now 42,000 bars of soap to 3 different institutions, and we're in the process of donating another 14,000 bars to Avenal State Prison, which has the highest or the second highest number of COVID infections in the state of California. We've done this through private donors such as Chris and Crystal Saka and Mara Sadler that just want to help people that are incarcerated. We've also donated masks in conjunction with other community-based organizations. Inside these facilities, people call often collect to our organization and to our Hope and Redemption team. And inside, the people inside that are incarcerated are worried about us. Like literally about family members, is everybody outside okay? And we're out here worried about them, wanting them to be safe and be able to be taken care of the way that we know that they should be, meaning less people should be in these institutions. And I had to catch myself because what I like to call them is barbaric institutions, because it's to me, there's no way, if a person's coming home in the next 6 months, why can't you release that person today? If we did that right now today, the population for the state of California would actually be where it's supposed to be at. The prisons would not be over capacity. So I've received phone calls from both family members and people inside, and literally family members want to know what they can do to shift what's going on inside. When is visiting come back, because they don't have visiting right now. Karen has been really involved with a lot of the phone call, being able to create free phone calls for people and actually connecting a lot of the young people with their family members that are inside. I think for people that are listening to this for the state of California, what you can do is write your state representative, call your state representative, email your state representatives, whether the state senators, assembly persons, including the governor, and simply state, why can't people who are within 6 months of coming home be released? It's that simple. You will drop the population. It's a large number, I'll say this and then I'll close. It's a large number of people, but look at it this way. In 1 week, the Department of Corrections released 3,500 people. In 1 week, nothing happened, not an uptick in crime, anything. Everybody had housing, everybody had resources. 1 week. We could release that many, twice that many people, or 3 times that number of people in 2 weeks easily without it being on a blip. Under the current circumstance, I'm not sure what that would look like, but that's what I have for you right now.
Okay. And Karen, from POPS, can you tell us what this has been like for you as someone that's currently directly impacted? Here you are in college, trying to graduate, working, but also being in touch with your father. What is he saying? What's going on? How is he feeling? How are you feeling? What does he have access to? Just tell us a little bit about, POPS and sort of what that program has meant to you. And also currently, what's happening as it relates to your father?
Yeah, so I just got an update yesterday from him. I communicate with him for the most part through JPay, which is a kiosk program, and it's facility based, so not other people have that luxury. But I can send him emails and he can send me emails back. And as of June 1st, they were in lockdown where he was at. Because a officer in his yard came down with the virus. But as of June 1st, they're no longer in lockdown. He says that 8 people per hour are allowed in the day room, and they can use the phone when they're in the day room. He did say that they were given face masks, but still no hand sanitizer. And yeah, so I've been communicating with him through JPay. Sometimes he calls me, sometimes I miss his call because I'm not on the phone. But I just personally, I had to kind of let go a little of everything because everything, it was too much and it was affecting my health. So I had to release a little bit and just distance myself from everyone and everything, and just focus on my schoolwork because I also couldn't focus. But now that's what's keeping me off of everything else. So yeah.
Thank you. Karen, oh, here we are. Karen, so I'd love for you to tell us sort of what's happening at the macro level in terms of the work that you're doing with the families that are directly impacted, what's going on in terms of communication, whether or not families are receiving free phone calls or videos, and how many, or if it's sufficient, but also after we move from sort of what's happening at that macro level in California, also just telling us a bit about what's happening for you and your sons and their communication with their father that's currently incarcerated.
Right. So, well, firstly, I have a son and a daughter. And I'll talk about them in a minute. But as you said, on the macro level, we work in 16 California prisons with children and their mothers and fathers, primarily fathers, across the state here in California. And phone calls since this all started have been significantly reduced, although there have been some free phone calls each month. This month, Wednesdays are free phone calls through GTL, the phone service that families have to maintain money on their phones to be able to speak to their loved one. They've offered Wednesdays this month. Last month, there was a couple days per week. I should note that we don't celebrate their generosity, in that we know that that company in particular has been literally raping our families for years, right? It is on the backs of women and children that mass incarceration lives. We plummet into poverty because we have to keep money on the books. We actually have young people that we work with across the state that are literally putting their lives at risk to go to their fast food job so that they can maintain money on their books to be able to talk to their dad, or to be able to send their dad money to be able to go to store. So that's kind of one of the macro issues that we're seeing happen. In terms of video visits, that has not been available to our children yet. It's something that we've been pushing for. We do know that as of yesterday, the Department of Corrections here in California has put that out to bid. So we do hope to see a rollout of video visits for families in the next couple of months. But in the meantime, children are really suffering, not knowing when their parent is going to call. And when they don't call, not knowing why they're not calling, right? Is it because they're sick? Is it because there has been violence at the prison? There is movement right now here in California. We are closing down our juvenile facilities, DJJ, Department of Juvenile Justice. And so that means, unfortunately, for both those youth and our people at the prison level, that 18-year-olds are being moved, for example, at the Valley State Prison. So you can imagine that that's causing violence that is affecting families. And I wanted to speak specifically also to something that Dr. Dorado, I believe it was, brought up about missed milestones, right? Our children have missed thousands of milestones, every birthday, every holiday that's been important to them, every graduation, every time that they made the 3-point basketball shot that was the winning shot at the game. Those important milestones have been missed repeatedly for children that have parents inside. And that is only compounded now by COVID, with this just overlaying trauma that is really crippling a lot of our kids.
And are your children in touch with their father? When is the last time that they were in touch? Did they speak with him? You know, how are they doing? How are they coping with what's happening?
Right, so my children were in contact with their father yesterday, and that was really emotional because they hadn't heard from him in over a week, and they did not know why that was. So I have a 16-year-old son and a 13-year-old daughter. And so on top of everything they're trying to process with homeschooling, not being able to see their friends, not being able to see the rest of their family, not being able to participate in their sports, the regular things that keep their mind kind of focused. They have extra time right now, let's put it that way, to worry about their dad. And that's exactly what they're doing. So it's expressed in something as simple as my son literally being in the kitchen making a sandwich and hearing his phone ring upstairs and almost killing himself running up the stairs in his flip-flops, thinking that's my dad and I need to get to that phone. And then the disappointment when it's not his dad, right?
Thank you, Karen. Layla, tell us sort of how you've come to be connected to children of incarcerated parents, and also more about Project What. What is Project What? What are you guys doing over there? Why is this important specifically to children of incarcerated parents?
So I am a child of an incarcerated parent, and my work with Project What, we stand for We Are Here and Talking, which goes for all 2.7 million plus of children of incarcerated parents across the U.S. We speak out and we train in public speaking, and we do policy changing across the Bay Area and further. Personally, my work with Project What is really impactful because I feel that every child of an incarcerated parent has the right to see, with, speak, and touch their parent no matter what. It doesn't matter what conditions they're in. And, especially with the virus going on and everything, it's super important that they know, my loved one is okay. My loved one isn't sick. There's, the system is super corrupt, as we all know, and just the insurance that our parents and our loved ones are going to be all right, it makes things 10 times easier for folks at home, despite what's going on in the world.
Right. What would you tell our audience are some of the, biggest issues that children of incarcerated parents face? Or, what is it, what do they face? What are some of the challenges? What is some of the support that you feel like they need, or what you want people to know about them or think about them?
So in general, I feel like one of the biggest assumptions that people make about children of incarcerated parents is that they're going to end up how their parent did, just simply because they are, the specimen of their parent, and they assume that we're all going to go down the same path and make the same actions. That is not always true. And I'm here to say that, as living proof, my mom, just because somebody goes down one path does not mean that they are necessarily a bad person. It just means that they made a bad mistake. So I feel that is one of the greatest assumptions that they make. And, we're all here to prove them wrong. and there's multiple organizations of brilliant children of incarcerated parents doing brilliant things and, you know, starting their own businesses and, you know, fighting for what they believe in. So I really feel that just don't judge a book by its cover, because there's always more to a person than their parents' decisions.
Right. One of the biggest things that I've, you know, even when I was young and I sort of, you know, heard, even now as an adult, when I go and I sort of talk about the work that I'm doing, there's this question of one time I was on an NPR show, I believe, and the host asked me if I or any of my brothers had been incarcerated. And once I told her that, yeah, one of them had been incarcerated, she said to me, oh, I was willing to bet that you had been incarcerated, right? And she went on to say that she felt like a lot of people believe that children of incarcerated parents should not be connected to their parents in the regard of visiting. There shouldn't be any visitation. And, you know, it was baffling that there was no concept of structural inequality or structural racism or thinking about the impact that legislation has, the impact of over-policing. So I think that it's great that you guys are doing this work to make sure that people are aware of the truth, right? And thank you, Layla. So I'm gonna go to JC. If you could just tell us how you came to be connected to Project What and what it means to you to be connected to children of incarcerated parents.
So I've been a part of Project What since June of 2016. I was 13 years old. My father was formerly incarcerated most of my life in and out of prison. And so that's why I joined. My sister was joining before me, and now she's the program coordinator. I'm the peer mentor, and my younger brother is now a youth advocate. So it kind of like ran the family, and we all really enjoy it and advocating for our rights, because growing up visiting our father in prison, we didn't really feel like we had any rights, and we were very like interrogated by the officers and guards that were inside the prison. So we just felt like we needed to spread the word that we have rights. And also we were very discriminated within our schools, in our school system, by teachers, counselors, and principals. Like we would be put on anger management or something just because our father was incarcerated, and they will automatically assume we had like behavioral issues because of it.
Mm-hmm. And I know that there's been some changes that have happened in terms of high school. So either Layla or JC, either one of you guys can respond to this, but what's changing for you in school now? Like what are the differences because of COVID? Now you're at home. I heard that there was a change in the GPA required to graduate. So if you could just tell us a bit about that, that would be great.
I am class of 2020, so I graduate this year. The OUSD had waived the GPA, because most of the time when COVID had started, no one had internet access at their house. You know, I live in a very poor community, so all the students didn't really have internet access at home or didn't have phones, so they didn't have the power to do their work online. So then they had to lower the GPA requirements to a 1.0 instead of a 2.0 GPA. But there are some schools, like, for example, McClymonds High School, like, they still have a 2.0 GPA, and they still have, like, senior projects were supposed to be waived for most students, but they require 10 to 15 pages for their students to graduate still. And it's just very, like, conflicting, because a lot of kids don't have the time to do that anymore, because they're working more and more and more, because, you know, they're older, or caregivers are older and more at risk of catching the coronavirus, and so they have to work more because they're like just less at risk, and they just feel more comfortable going out to the communities than allowing their parents to. So having to balance your work and also taking care of their family, and having like disabled family members in their homes is like getting really difficult, because they can't find time to do the work, or when they do, they can't focus, or because graduation ceremony was taken away from them, they just don't feel like it's worth it anymore.
Mm-hmm. And Layla, what do you think should be happening? What kind of access do you have in school? Are they sending laptops? Are they giving you access to what you need to make sure that you're able to thrive? Like what's going on, and what do you think should be happening?
Okay, well, I am class of 2021, so I still have a year left of my high school experience. So far, we have been, since going on quarantine and lockdown, we have been doing all of our classes through Zoom, or for the teachers who don't prefer Zoom, they've just been sending out assignments via Google Classroom. So we've been doing all of our work online. There is options. I remember reading some emails about having Chromebooks that they can come and pick up. But it's, you know, there's Chromebooks, but do the kids necessarily have internet access for the Chromebooks? And, you know, there are bigger households. So, you know, not everybody can be doing their work on constant Zoom calls all the time at the same time. You know, that's going to slow down internet and it's just going to make it harder for kids in general to do everything at once. So I feel, you know, that was definitely a good idea. But, you know, what are we doing for the people who, you know, now they have the laptop, now they have the computer, but what are they going to do? Like Wi-Fi and connection wise. So yeah, and then they're also discussing having us, you know, what is next year going to look like? Are we going to go back full time? Obviously having to wear masks and gloves, of course. Or are we going to do, you know, some days they're like going to split up the school. Some days one group goes, some day another group goes, and then it's all online for like the rest of the time. Or are we just going to completely go back online?
I want to remind our audience that we are taking questions, so be sure to send any questions you have for any of our panelists. You know, questions are open, so make sure that you're sending in your questions. Sam, I'd love for you to tell us about some of the things you think should be happening in terms of releases. Are there specific people that you think, and Karen, you could also answer this, are there specific people that you think should be released? And is there anything happening at the arrest level? Are people no longer being arrested for low-level offenses? Like, what are you guys seeing in terms of the change of people being arrested?
It's interesting that you should say that, because this kind of brings in a issue that will be on our ballot in November for bail, which is really known as Senate Bill 10. So when COVID hit, what the Judicial Council got together and basically said, okay, low-level offenses, they'll be arrested and released. They would not be booked into the county jail. So literally, that was part of the way that they were able to decrease the number of people in the county jail. We currently have, or will have, on our ballot a measure to determine if we want to get rid of cash bail. Obviously, it works.
Yes.
In the past, the biggest issue has been people worrying about what does it look like, what assessment tool will be used. Obviously, there's a way around it, or else this would not have worked in our current situation with COVID. So the county jail was, prior to the unrest that's going on right now, was at historic lows, surprisingly.
Yeah.
And so just that's something that, especially the young people, please look at that ballot. If you can vote, that is your voice, that is your power. So that's one thing. In terms of people that could be released, there are many people that can be released, but this is also a slippery slope when it comes to politics and careers for the decision makers. So if you look at the people that they released initially, the 3,500 people that they released, they were people that will be released in the next 60 days anyway.
Right.
So if we were to look at, and I previously said that if you were to release the people that would be released in the next 6 months anyway, that would decrease the number of people that are currently in California's prisons significantly enough to be able to create social distancing.
Right.
This would be a cross between people that have been convicted of both violent and nonviolent crimes. No one wants to talk about people that have been convicted of violent crimes. But here are some statistics that I think would really, really interest people.
Yeah.
People that have been convicted of violent crimes and have done significant amount of times, and I'm one of them, who have done the work, so to speak, or really applied themselves in rehabilitative programming, or were life prisoners, now since Governor Brown and between Governor Gavin Newsom, about 6,000 people have been released that fall into that category, with a less than 1% recidivism rate. Less than 1% go back. So in this conversation, we need to consider that group of people that are currently in custody, as well as people that will be coming home in the next 6 months anyway. There's a way to do it, but the problem is history scares a lot of politicians. If one person does something wrong, then broad strokes are applied, and then politicians can possibly not get elected to their next office. So the outcry from the public, from the voters, must be stronger in order to look at it from a humanity perspective. These people that are incarcerated matter too. They're our brothers, our sisters, our moms, our daughters. They're people that matter. Just thinking in terms of in New York, for instance, when Andrea Circleville died in custody while giving birth to her child, New York's governor took the action of releasing women that were pregnant. Can we do that in California? I mean, like, there are realistic ways to do this where we'll continue to make sure that our communities are safe, as long as there are resources that are available as people are released. And we have community-based organizations that are prepared to do the extra work to make sure that happens. But specific to your question, I would say, let's look at people that will be released in the next 90 days to 120 days if we can't do 6 months. That will significantly decrease the number of people that are in state prison. The other thing, which just really, really bothers me, is booking people into the county jails during this unrest. We're literally going in reverse of the gains that we've already made to make people safe. So I would really suggest looking at people that will be released in the next 120 days to 6 months, and communicating as done before with all of the community-based organizations up and down the state with a system with both transportation and resources to be provided for people as they're released.
Okay, thank you. We have some questions from the audience, and this is for Layla, Karen, and Jacia, whoever wants to take it first. And the question is, what's been the hardest thing about having a parent incarcerated, whether it's currently or previously, and how have your relationships been impacted by these programs that you're participating in? Ooh, who's gonna go first?
Okay, I'll go ahead. Oh, okay. So personally, one of the hardest things about having a parent formally incarcerated for me was, growing up, just growing up with not having, my parent around, not having, the standard normal family that society puts in front of you, the expectations of having a mom and a dad there with you, to show up to, sporting events and performances and talent shows and, all of the above, not having the classic support system. Society is just very judgmental in its own ways, and sometimes it makes you often feel like you're not normal or you don't fit in. But, as you grow up, learning to battle through it, you realize, you don't want to be normal. You don't want to fit society standards all the time. So I feel like just having a parent incarcerated in a way makes you stronger. It makes you more unique. And being in these organizations, it really helps you not only strengthen your own emotions and battle what you're going through internally with having to deal with your specific situation, but you also get to go out and you get to help others that are in the same situation as you. Learn that it's okay and it's not something to be ashamed of, and it's not, you don't have to be like them. You don't have to make the same mistakes, and it's just beneficial all over in my eyes.
Thank you. Karen, are you going to say something?
Yeah, I think the hardest part of having a parent in prison is just the uncertainty. I think more so now than ever. I think uncertainty is always something that worries you throughout, because you hear that you go visit and you hear that your parent's in the hole because of this or that, and then you don't really know about their safety all the time. You don't really know if they're safe all the time, like somebody's gonna stab them or things like that are gonna happen. But more so now because prisons are very populated. So I guess it's really stress. If you let it stress it, that's why I had to release. I had to let go, because it can be very stressful not knowing whether they wash themselves or whether they're too close, whether I don't know if he's gonna catch the virus, he's gonna die. But yeah, it's very stressful. As far as how POPS I came into POPS while I was in college, so I wasn't really involved in it when I was in high school. but I know that it creates like a community for students impacted by incarceration. For me personally, I had to overcome the stigma of the community out here, because unfortunately, like, the victims lived within my community, so I had to deal with you know, like, throughout, like, when I was little, like, stares and like comments and things like that. So, but Pops created a more positive community for me with people who have gone through similar experiences. And right now they're hosting online meetings twice a week. And it helps with the stress because it creates laughter and they teach different things. We have speakers, and yeah, that's all I have to say.
Jaycia and Layla, could you guys tell us what it is that you hope to do in your future? It looks like someone from the audience is interested in what you guys plan to do with your education. Where are you going next?
So for me, since I graduated this year, I will be attending Sacramento State University. Because most of the courses will be online, I will still be able to move out there, but I won't be able to like physically go to school, which is fine. I will be majoring in psychology, specifically child psychology, so that I can work with children who have had their parents incarcerated, like during the younger ages, because Project What, we mainly mentor ages 12 through 19, and I feel like most of the trauma happens when you're younger, and most of the time when kids get to Project What, they've already been through so much, and we just try to help them figure out what they're going to do with all that trauma and pain, like turn it into ambition, but no one is really there to help them while they're younger. So that's what I want to do, is like tackle the obstacles and stuff and trauma that they go through when they're younger, while they're younger, instead of just waiting until they're older.
Okay. Violet asks, what organizations are helping people once they do get released during COVID times, and how do they help? Sam or Karen, if that is the question.
So we have, so interesting. So ARC, the Anti-Recidivism Coalition, and many others are working together to help people as they come home. Now, just recently, when the 3,500 people were released, CEO, Center for Employment Opportunities, Amity, A New Way of Life, and a number of other community-based organizations got together and were able to get a group of foundations to donate or to supply resource monies. So as people came home that could not get IDs or social security cards or anything that were necessary or get a job, what we did was enroll them in our various programs, and every month we're able to give them a cash stipend that will hold them pretty significant that these foundations have donated. We're looking and asking the state to match those funds so we can go wider. This is right now just in Alameda and Los Angeles County, but we like to go wider and do more. Just in part of the reason that for the audience to be aware, 1/3 of the entire prison population comes to Los Angeles County. So that was part of the reason why Los Angeles was targeted to be able to get these resources out. There are other organizations across the state that are doing great work. We can provide a resource guide, and also Root and Rebound can provide a resource guide for people that are returning home. The greatest thing that I would suggest to anyone that wants to know more or would like to guide people to resources, if what we do at ARC and many of our partner organizations do, if we can't provide housing or whatever it is that an individual needs, we will refer to another organization until we make sure that the individual that has come home has the resources in a safe place to stay.
Thank you. So Layla, Jaycia, and Karen, it looks like we have, and Karen McDaniel. Looks like it's for all of you guys. And this is from Allison Hallahan. Hey, Allison. And the question is, what can adults and others in your life do to support you? How can adults support children of incarcerated parents? How can they support your parents? What do you need? What do your incarcerated parents need? So Karen, if you want to lead, that would be great.
Karen McDaniel or me? Okay. I don't know. I think, I'm sorry, Karen McDaniel or me? There's two Karens.
Oh yeah, Karen, Karen from Pops, Karen A. Yeah, they want to hear from the youth.
Well, as far as like, I feel like a lot of children with incarcerated parents experience is that I feel like I'm alone in this, and like my relationship with my dad, and it's not perfect. It's not where I would want it to be, but I feel like there's no support. And I know there's therapists in prison for them, but I don't think they're helpful. I don't think they care. They don't care. So I think quality therapists for them. And out here, I don't know what I need, but that's what I would need for him, more help.
Okay, thank you. Layla or Jacia, do either of you want to chime in?
Casey, you could go first. You look like you're about to say something.
Okay, so I know that my friends who have had their parents incarcerated, they have they see therapists, but like a lot of the time they can't go in person, so a lot of their therapists change to phone call or Zoom sessions, and I feel like that's very helpful. Or like even if you're not like in that field of work, I feel like just being there to support, because a lot of us have anxiety and then stressing about what's happening next, because a lot of people are getting laid off and have to file for unemployment, and they don't know what they're going to do after all this is over, like if they're even going to be hired because of their conviction. Like it's very hard to even get a job because you're a convicted felon. I know that for my father that's the case, and like we're just like scared, like what is he going to do after this? Or if somebody looks at his record, they're not going to want to hire him. Even with me filling out like stuff for school and getting loans, they deny it because they have to do a background check on my dad. And I feel like just giving them resources that they can go to make them know that they're not alone in this, and you know, give them organizations that they can join to help them once all of this is over.
Personally, I feel so definitely what Karen had said about the support within the prisons. I'm also part of an organization called Project Avery, and within that organization we have the peacemakers. So we go in and to the prisons and we help run rehabilitation workshops. And so the men in blue, they really get to pour out their emotions, and they get to talk to us about what are some questions that my son or daughter or grandchildren might have when I am released, or when they call me, or when they send me letters, and how would I respond to that? How would I go about thinking about that process? And, you know, just what would I do? And in return, we get to help them. And personally, for me, it helps with my healing too, because it helps me like, oh, this is where, you know, my incarcerated loved one was coming from when they asked me this question or when this happened. So I feel like it's a really good program to help with healing on both sides.
Looks like someone also asked if there are any bills that they can support. Any bills working on behalf of children of incarcerated parents, of families, of reentry, just sort of any bills. And if there are no bills specifically, is there somewhere they can go to learn more about how they can help?
So definitely some bills that can be supported. So that the initiative for, I saw in the question box too, the initiative for bail reform has not been given an official name yet, but just be aware that it will come out. If you go to ARC's website, you'll be able to find out more about some of the policies we're working on. We're working on reforming parole, and the reformation of parole is basically incentivizing education and employment. To the young people that are on this conversation, Ms. Diamond, Karen, in our organization, we offer free therapy for every one of our members that are formerly incarcerated. So anyone that comes home that wants a therapist, it's free. We have an office in Sacramento. We have an office in Los Angeles. We have housing in Los Angeles, and therapy is available to our now over 1,600 members. It does not cost anything, and we promote therapy. As a person that spent 24 years in prison, I know how important it is. Also, in terms of careers and jobs, we help in that area. And we're not the only organization, but I can speak specifically to our success in the construction trades and some other unions that we are now opening up. So all of those avenues are available as long as when people come home, they plug into these resources. They're vitally important to get a person out. Imagine this as a high school dropout, and everything that was negative about me when I went in as a teenager, I came home, and now the organization I run has basically passed probably some of the most creative reforms in the state of California in recent times. In addition to that, ACA 6, which is voting rights for people that are on parole, it will be a ballot initiative also. We're working on another Senate bill called Senate Bill 111 or 1111, which deals with juveniles and not sending juveniles into adult facilities. So there are a number of different bills that you can support. I'll give a shout out to other organizations that are also working in areas of legislation such as Initiate Justice, Restore Justice, All of Us or None. All of these are organizations that work to reform our current prison system. Please Google them, look up what they're doing. There are different ways you can be able to support. And know this more than anything else, young people, like when your parents come home, they're gonna try to relive a lot of life. Like my daughter was 24 when I came home, and I had to understand that I couldn't be her dad. And she was not a little baby or a little girl no more. She actually had a son, and I had a grandson. So part of it was just working through it together with your dad, step by step. But they will come home, and they will be there. Just don't be uncertain. Continue to support them, and know that you have thousands and thousands of people that want to support you, and organizations that also want to support you, and that you also have a powerful voice in this space. Do not be afraid to use that voice.
Thank you, Sam. So we want to ask anybody in the audience, if there are any resources that you guys know of, please drop them in the chat box, and we'll do the same at some point. They'll create a list and sort of sending out to everyone. I want to thank Karen McDaniel. I want to thank Layla, Karen, Jacia, and Sam Lewis for joining us on this amazing panel. It's been very informative, and I'm sure that all the participants are, we're glad to be here. There's still questions that we don't even have time to answer. So until next time, thank you guys for all tuning in, and Carol Burton is going to take it away.
Thank you. Thank you for an informative, honest, intimate conversation about the realities of COVID and children and families of the incarcerated. I want to say to the attendees who joined us today, first of all, we know that you could have been anywhere else, and we appreciate your involvement and your commitment to supporting the well-being of children and families of the incarcerated during this particularly turbulent time. I just want to ask you to look forward to a survey that we will be sending out. We want to know more about what currently exists, if you're interested in partnering with us. We also want to be able to include you on the part 2 of the series that will be coming up in the next 3 weeks. And so before I leave, I want to thank our co-host, the Children's Defense Fund of the state of California. I want to thank all of the inaugural members of the Bay SIP Steering Committee for your work getting us here. I want to also thank the funder who made the launch of Bay SIP possible over the last 2 years, and that is the Zellerbach Family Foundation. So I'm asking that all of you be safe. I thank all of the panelists, our moderators, and stay tuned for more from this dynamic duo.